Can ESR levels predict your chronic raw outlook? Have you ever wondered if your erythrocyte sedimentation rate, or ESR, can give you clues about your long-term outlook with chronic rheumatoid arthritis? Let's dive into this topic and explore what ESR levels really mean for managing your condition. ESR is a blood test that measures inflammation by checking how quickly red blood cells settle in a test tube over 1 hour. While it is commonly used to monitor inflammation in rheumatoid arthritis, it is important to note that ESR is not specific to rheumatoid arthritis. Many factors can influence ESR levels, including infections, age, and other inflammatory conditions. Generally, normal ESR values range from 0 to 15 millimeters per hour in younger men and can go up to 30 millimeters per hour in older women. When it comes to predicting the chronic outlook of rheumatoid arthritis, ESR levels alone have limited value. Research indicates that ESR correlates only weakly with clinical measures of disease activity in patients. This means that while a high ESR can suggest active inflammation, it does not reliably predict how severe or persistent your rheumatoid arthritis will be over time. In addition to ESR, C-reactive protein, another inflammation marker, is often measured. However, like ESR, C-reactive protein shows only a modest correlation with disease activity and outcomes. To truly understand the long-term course of rheumatoid arthritis, several other factors come into play. These include the presence of specific antibodies, such as rheumatoid factor and anticyclic citrullinated peptide antibodies, the duration of symptoms, and any early joint damage visible through imaging. These elements provide a clearer picture of whether rheumatoid arthritis will be chronic and progressive. In clinical practice, ESR is useful as part of a broader assessment to monitor inflammation and response to treatment. However, it should not be used in isolation to predict the chronicity or long-term outlook of rheumatoid arthritis. Effective management of rheumatoid arthritis focuses on early diagnosis and comprehensive evaluation, which includes clinical signs, antibody testing, imaging, and regular monitoring of disease activity. This holistic approach helps guide treatment decisions and improve long-term outcomes. For those living with chronic rheumatoid arthritis, understanding that ESR is just one piece of the puzzle can be empowering. It encourages both patients and healthcare providers to focus on a well-rounded approach to disease management. Regular monitoring, effective flare management, and addressing complications requiring integrating laboratory data with clinical findings and patient symptoms. This way, you can optimize your care and maintain a better quality of life. Always remember to consult with your healthcare professional for personalized advice and treatment options tailored to your unique situation.